Welcome back to my YouTube channel. This is Dr. J, and I'm currently training to become a family physician. I believe knowledge is power and sharing is caring. And today we have a special guest, Dr. Jennifer Kwan, who has been taking an active lead in tracking COVID cases. And she has been featured in multiple news, and today she will be sharing important updates on COVID. So stay tuned. So we have Dr. Jennifer Kwan here today. Are you able to briefly introduce yourself?
Okay, so my name is Dr. Kwan. I'm a family physician in Burlington, Ontario. I work in a community family practice, and I guess lately I've been tracking COVID numbers on Twitter, so that's how you may know me.
Right, that's amazing. And can you tell me a bit about your working experience during COVID?
So right now, I would say 95% of care is provided over the phone or virtually. So for any patient that needs assessment, other than babies for immunization, newborns, prenatals, usually we will always call people on the phone first to make sure that they can be assessed over the phone. Maybe we can just take care of their issue without having them come in person. If there is anything that requires an in-person exam, then I will bring them in for assessment.
Okay. And how have you found that transition into that new style of practice?
It's not too bad for me. I think that I'm surprised that there can be a lot of things that are managed over the phone. And I think patients also find it convenient, and they're also relieved that they don't have to come into the clinic. Because I think a lot of people have fear that they will catch COVID coming to the clinic. In our clinic, we also have a lot of new protocol to keep everyone safe. So even if they have to come in, we think it's pretty safe.
Okay, that's good to hear. And you did say that you have been tracking COVID cases. Are you able to share some of the statistics that you have?
Sure. Let me just pull it up quickly. So I think today's numbers, one of the big numbers today is that there has been more deaths. I think it's one of the highest that we've seen so far. There's been 86 new deaths today. So that can be a significant amount. And most of these deaths can be attributed to long-term care homes and other high-risk settings, which we have been monitoring very carefully in Ontario. They've recently started publishing data on retirement homes outbreaks as well. So that may account for a large proportion of the deaths. We also have some good news today. We are continuing to see a decline in the total number of active cases in Ontario. I think we're at approximately the 5th day of decline in active cases. So that is a positive sign. We're hoping it will continue to go down. That means more people are recovering from the virus versus infection. So that's a really good sign. So hopefully it's a continued trend, because we are waiting for at least the 14 days of decline in order to reopen Ontario, and that's what everyone has been waiting for.
Oh, here, a lot of good news. And can you share some of the things that we can do kind of moving forward to keep this trend?
So everyone's been doing a great job staying at home. Everyone's an expert at this. I'm sure everyone's really good at washing their hands for a long time. I think right now the next big thing we would like everyone to know is to wear a mask whenever you go in public, especially in places that you cannot properly socially distance from other people for 2 meters guaranteed. So if you are going out for a walk by yourself in the forest in the middle of nowhere, okay, you don't need a mask. But if you are going to the pharmacy, the grocery store, anywhere, especially for indoors and closed spaces, it's really a good idea to wear a mask. You can create your homemade mask. I'm sure you can give your viewers some links to some great resources too, because people can make their own masks at home. And when everyone is wearing a mask when they're going out, it does reduce the risk of infection and transmission on a population level.
Okay, that is a very great advice. And do you have any key message to the public that you want to share?
Wear a mask.
Wear a mask.
in addition to wearing a mask, please continue to respect social distancing guidance. Keep an eye on it. Be patient. I know that it's a difficult time for everyone to be at home, and not everyone has, the same kind of home experience, right? We are worried about increases in domestic violence, child abuse, and it is very difficult, especially for isolated seniors. So if you're at home, reach out to your loved ones if you need help. There's lots of community supports. Call your family doctor if you're not sure if you have one. So there are a lot of things that can help your home experience, but please be patient. Please continue staying at home until the public officials say it's okay to relax things, because we do not want to end our distancing too early and too soon, because it can cause a wave. So we would not have flattened the curve. We would only have delayed the curve.
Right. Okay. That's amazing. Thanks for sharing all your information. That was very informative. And I hope all the public also find that to be very helpful. Thank you for your time.
Thank you.
If you found this video to be helpful, then please don't forget to like and subscribe. You can also follow the updated trend on COVID by checking out Dr. Kwan's Twitter and the webpage. I include the links below. You can also find me on my Instagram. And remember that being wealthy is healthy. It's Dr. J signing out.